Cherie is a 58-year-old who fell 2 months ago and sustained a fracture of the right distal radius. She had surgery to repair it 5 weeks ago. She has been participating in occupational therapy for 3 weeks. She had been experiencing pain, swelling, and numbness on the back of her hand, and now her main symptom is numbness. She is right hand dominant and a fitness instructor who is ready to get back to teaching exercise classes. Her doctor ordered OT twice a week for 10 weeks, and her precautions from her doctor are no lifting and no strengthening exercises. Cherie has pain and swelling and decreased range of motion in her wrist and thumb, specifically decreased range of motion in her thumb MCP flexion, thumb IP flexion, forearm pronation, forearm supination, wrist ulnar deviation, wrist radial deviation, which is almost normal now, wrist extension, wrist flexion, and her palmar abduction is normal now. Today's section will first have sensory assessment of a monofilament test to assess if her numbness is decreasing or remained the same. A paraffin bath to increase range of motion, decrease pain, decrease stiffness in her joints, decrease edema, and increase healing. Even though numbness is a precaution for paraffin, the numbness in her wrist is in a limited area and she can still feel heat and pain with the majority of her hands, so it still should be a safe and positive treatment. Metal in the wrist or in the hand is also a precaution, and we'll just assess by checking and making sure that the wax is not too hot, or the paraffin wax is not too hot, and that she is not in any pain after one dip. After the paraffin bath, Cherie will be fitted with a wrist cock-up splint orthotic and given patient care, education, and safety. Welcome to our clinic. Hi, my name is Christi and I am your OT student for today. And what is your full name and date of birth?
Cherie Lee.
Cherie Lee, okay. And what's your date of birth?
January 2nd, 1966.
Okay, that sounds good. And you're here because of your broken wrist.
Yes.
Can you tell me how it's been feeling lately?
It's been feeling okay.
Mm-hmm.
Not really a lot of pain anymore.
Good.
It is quite a bit of numbness still.
Okay, yeah.
A lot of numbness.
Okay. And I still see a little swelling.
It is still swollen, yeah.
But not as bad, maybe?
It has improved.
Okay, good. That sounds good. Well, today we're going to do a sensory assessment. It's called a monofilament assessment. And we're going to test and see if we can feel different sections on your hand and see if the numb area has gotten smaller or if it's the same, to see if the gliding exercise, the nerve gliding exercises have been helping.
Okay.
Okay?
Does it hurt?
It doesn't.
Okay.
It's just going to tickle or kind of have a light poke. Okay?
Okay.
Does that sound good?
It does. Okay, so for the monofilament, we'll first work on your good hand. Okay.
And I'll assess the different sections, and you can just say touch if you feel it, or yes.
Touch.
Mm-hmm.
Touch. Touch.
Okay.
Touch.
And I'll have you close your eyes.
Okay.
For it starting. And I'm gonna start with, can you even see this? The light one here.
Touch.
Mm-hmm.
Touch. 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 Touch.
Mm-hmm.
Touch. Touch.
Okay.
Touch.
You're doing pretty good. Okay, we're gonna try your other hand.
Okay.
Okay, you ready to close your eyes?
I am.
Okay.
Touch. 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 Maybe touch.
Maybe touch.
Maybe touch.
Okay. So it looks like you still have a small section here that has decreased sensation.
Okay.
Okay, so it couldn't test as clearly as your other hand.
Okay.
But it looks like it's shrunk.
Oh,
So
good.
you are getting some sensation back.
Awesome.
So that's a good sign. So the next thing that we're gonna do is probably work on paraffin bath.
Okay.
Have you ever done paraffin before?
I have not. What is that?
Okay, it's kind of like a wax. They used to burn it in lamps, but we're gonna,
Okay.
it'll be heated up, not crazy hot, just more like lukewarm.
Okay.
And
So
you'll-
it's not gonna burn me?
It's not gonna burn you.
Okay.
No, it should feel like when you get a warm towel out of the dryer and you wrap it around yourself. But we're gonna
Okay.
instead wrap it, dip your hand in, and it will help you be, I don't even know what I'm saying anymore. Didn't Okay, Cherie, we're gonna wash your hands. But before we do that, I'm gonna make sure there's no open wounds or bleeding and there's no fever. Everything looks good so that you can do paraffin wax. Okay, okay. Wash with soap and water. Wash all the way up to your elbow just in case. Okay, Cherie, so we're gonna have you put your hand here, and then I'm gonna have you wrap up and put it real comfortable here. And you can sit here. We're gonna go over just some patient care and exercises that you're gonna do again at home. And we'll sit for about 10 to 20 minutes.
Okay.
Okay? Okay, Cherie, how did you like the paraffin bath?
It was really nice.
Okay, I felt like it was pretty good. And it wasn't too hot.
It was not too hot, no.
Okay, good. What we're gonna do now is I'm gonna talk to you about getting you an orthosis. This is a wrist cock-up splint that we've made to fit to your hand.
Okay.
And it will help stabilize your radius as you're healing.
Okay.
Okay. So to keep it clean, we're gonna have to clean your skin on your arm and your wrist and your hands with mild soap and water, and the same with the orthosis.
Okay.
Okay, and it's gonna have to be completely dry, both your arm and your hand and the orthosis before you put it on.
Okay.
So you don't want any moisture that would make more rubbing or blisters or anything, or
Okay.
germs. You wanna keep this away from high heat sources.
Okay.
The main thing that clients accidentally do is they would leave it in their car in the heat.
Okay.
And it would just completely shrink and be destroyed. So we wanna
Okay.
keep it away from, heaters, stoves, anything that would be a high heat, because it would melt the plastic.
Okay.
Okay. And then I don't want you making any at-home adjustments to how you should be wearing it or doing it or trying to mold the plastic. If you need to change it, come back.
Okay.
Okay, and we'll work on it. And then if after wearing it, if you have any pain or swelling, skin irritation, redness, numbness, or tingling, then you need to consult your doctor.
Okay.
Okay, and totally tell me next too.
Okay.
Okay, so we're gonna put this on.
Okay.
Okay. Put that on. Put your thumb through there. Okay. And then we will loosely put it on. And we want it slightly firm, but able to put a finger through.
Okay.
Okay. Do that one.
It's nice that it's adjustable.
It is adjustable and it's pretty soft material, so it should help. There you go. That just right. Let me put finger through. Okay, so how does that feel?
That feels really good.
Yeah. So it should help you be able to do things around the house, but also keep it at a good 30-degree angle for a wrist flexion for healing.
Okay.
Okay?
And then do I wear this while sleeping?
I think you can.
Okay.
Yeah.
Okay.
And also if you have any swelling, having it up on a pillow for sleeping can also help.
Okay.
Just
And
a little bit.
do I take it off to shower?
You can take it off to shower, or you can put it in a bag
Okay.
and wrap it up.
Okay, so like my cast.
Yes, just like your cast. Okay.
I don't think I have any questions.
Okay, good. Then I'll see you again next week.
Okay.
Okay.